So I'm going to be doing a video today on injections, subcutaneous and intramuscular. So my patient is Mr. Mancini. I'm just going to get right into it. So before I would give him his medications and prepare the medications, I would look at his MAR and confirm the 8 rights of medication administration. So right patient, right reason, right medication, right dose, right time, right frequency, right site, and right route. So just making sure those are all correct. And then I'd also look at his allergies and just confirm them. And so in this scenario, Mr. Mancini is allergic to codeine, so I just have to be aware of that. And before I give him his medications, I'd also just look at his body composition and recognize that he's a normal body build, so I'm following the appropriate guidelines for normal body build. If he was obese or thin, or really thin, I would change the needle gauge and the needle length appropriately for that. I'm just gonna get these medications ready. So for subcutaneous, I'm giving him 5,000 units of heparin, and with the calculations, I figured out that that's 1 milliliter. So first I'm gonna be opening this ampule, and I'm gonna make sure I open it away from me so that I don't hurt myself. Like that, there it goes. So just want to be careful because it is sharp now. And then I will take an alcohol swab and just clean the outside of it. And then with the subcutaneous, you want to use about a 25 to 27 gauge with a 1.6 or 1 to 1.6 centimeter needle. Because he's normal body build and I'm doing it in the stomach, I'm doing a 25 gauge with a 1.6 centimeter needle. So I'm just going to attach the needle to the gauge, make sure it's on tightly. I'm going to remove the cap, and then I'm going to put it upside down. I feel like I'm doing this wrong. Is this right?
Just move the pink thing.
So I'm just going to move the pink thing out of the way. Looked a little odd to me. Alright, put it upside down and then draw out 1 milliliter. Making sure there's no air bubbles. I'm doing a little more than 1 milliliter just so I have room to get rid of any air that's in there. And I chose a 3 milliliter syringe because it's a 1 milliliter injection. I want to make sure I can really see how much medication I'm giving him. So that one is ready, so I'm going to use safe considerations to ensure I recap my needle properly, not like that. There we go. Alright, so now I'm going to be preparing the intramuscular injection. Before I do that though, I'm just going to put my label on the subcutaneous injection, just with what time I prepared it, the dose, and the medication that is on there, as well as the patient, so that if anyone else comes across it, they know what it's for. Okay, so now onto the intramuscular. So for intramuscular, you usually want to do a 19 to 22 gauge needle with about 2.5 to 3.8 centimeter needle length. For Mr. Mancini, because he's normal body composition, I'm doing a 2.5 centimeter as well as a 22 gauge for his deltoid muscle. And because I'm administering 0.5 milliliters of Haldol, I'm going to be using a 1 milliliter syringe again so that I can appropriately see how much medication I'm giving him. I'm going to attach the needle onto this. Get the amp vial open. I'm going to clean it with an alcohol swab.
Try to put it on tight and then like pull.
There we go. going to tip this upside down again and inject the needle into it. Again, do a little bit more than 0.5 milliliters so that I have room to get rid of any air that is in there. You can see an air bubble there. Try to get it to the top so that I can inject it back in. All right, 0.5. And again, I'm gonna do safe practices to recap the needle. There we go, and then put an injection on it as well. So again, just having the right patient, the right time that I administered it, the right drug, and the right dose. Now I'm gonna go to my patient, do some hand hygiene. So before I would give him the medications, I would just make sure this is the right patient. So I check his wristband, that says Mr. Mancini, look at the allergies on there, the hospital identification code, and get him to recite his birthday to me as well. Next, what I would do is clean the sites with alcohol swabs. So Mr. Mancini, I'm going to be performing 2 injections on you today. I'm going to be doing one in your stomach, and I'm going to be giving you your heparin, which is your blood thinner. And I'm going to be doing one in your arm muscle, and that's your Haldol, just to calm you down a little bit so that we're nice and comfortable here today. So when I give you the injection, I'm going to inject the needle. I'm going to inject the medication into your muscle or your subcutaneous tissue. Hold it there for a couple seconds so that the muscle or the medication can disperse, and then I'm going to remove the needle. I'm going to ask that you keep your arm as relaxed as possible because that will give you the least amount of pain as possible. And you also might feel a little poke when the needle's going in, as well as some tingling or burning, and that is completely normal. So first I'm just going to clean the subcutaneous site. So when we're doing a subcutaneous injection, we usually do it in the upper side of the arm, the stomach, or the outer part of the leg. So in this case, I'm doing it in the stomach, so I want to do about 1 inch away from the belly button. So that's clean. And then when I'm doing an intramuscular injection in the arm, you usually do it in the deltoid muscle, the gluteal muscle, or the vastus lateralis muscle in the leg. In this case, I'm doing it in the deltoid muscle. So to appropriately landmark this, I'm going to find his acromion process on his shoulder, about right here, and then I'm going to do 2 finger breaths down, so like this, and then I'm going to make that my injection site. Now I'm going to be actually administering the medications. So first I'm going to be doing, obviously in real life his shoulder wouldn't roll away. First I'm going to be doing the subcutaneous injection. So just looking at my label, this is heparin 5,000 units, and that is what I want to do. I'm going to take off going to do hand hygiene first, and then I'm going to put on gloves, just because we're giving him a needle and we don't want to. There's a possibility of getting in contact with bodily fluids. I always have a really fun time putting on gloves. All right. So now I'm going to be giving him the subcutaneous injection, so I'm going to take off the cap. And I'm going to be inserting this at a 45-degree angle. If it was insulin, or if he was more of an obese patient, I would do a 90-degree angle. But because he's a normal composition, I'm going to be doing 45 degrees. I'm going to pinch the skin and then insert it at a 45-degree angle. Inject the medication, hold it there for a couple seconds, and then remove it, let go of the skin, and cap the needle so that it's safe. Next, I'm going to be doing the intramuscular injection. So again, just confirming that it is Haldol, and I'm doing 0.5 milliliters to give him 1 gram. Take off the cap. I had difficulty with this last time too. Oh no, don't you dare, come on. There we go. Alright, so again, I'm gonna find the area that I landmarked before. Excuse me, I'm gonna be inserting this one at a 90-degree angle. Injecting the medication, holding it there for a minute, and then removing it. In this case, I don't have an automatic locking thing, so I'm just gonna safely recap it. And for an intramuscular injection, you can also do a Z pattern, which is just to ensure that the medication stays in the muscle area and doesn't disperse anywhere else. All right, Mr. Mancini, how are you feeling? Are you comfortable?
I'm okay.
All right, good. Well, I'm all done here. You did very, very well.
Thank you.
You're welcome.
You're gonna be a great nurse, Kara.
Thank you so much, Mr. Mancini. All right, so now I'm just going to dispose of the materials that I used. So the garbage obviously goes in the garbage. And then my needles that I used are going to go in the sharps container, as well as the ampule that I used because that has a sharp edge right there. And then after I was done this, I would go to his MAR, write the medication that I gave him, write the time, and sign my name, just to do appropriate documentation guidelines. That is the end. Thanks for watching my video.